Tubal disease can be one of the many factors impacting your fertility. And if you've been diagnosed with a hydrosalpinx, a very specific type of tubal disease, you can be left with many questions. What exactly is a hydrosalpinx? How can it impact your fertility? And what can you do to treat it? Today, we're going to do a deep dive into hydrosalpinx. I'm Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist, helping people build families and deal with tubal disease for over 20 years. And I love educating. If this is your first time finding the channel, welcome. I'm so glad you're here. Be sure to subscribe so you get my weekly videos all about reproductive health. If you're coming back, welcome back. I am so glad that you find this content valuable, and I'm really happy that you're here. There are two other ways to stay connected and learn. One, sign up for my weekly newsletter where I give you fertility in the news and lots of educational content. You can sign up in the link in the description below. And the other is my weekly podcast, the Brave and Curious podcast, where I do deep dives into topics and interviews with fascinating people in the field. Now, today, we're going to talk about hydrosalpinx and learn all about it. This is a very specific type of tubal disease that can impact your fertility, and we're going to go over 5 main topics. Number 1, we're going to go over exactly what hydrosalpinx is. Number 2, how it's diagnosed. Number 3, the causes of hydrosalpinx. Topic number 4, the impact of hydrosalpinx on your fertility, exactly how it impacts fertility and difficulty conceiving, even with an embryo transfer and IVF. And topic number 5, we'll go over the treatment options for hydrosalpinx. Topic number 1, what exactly is a hydrosalpinx? Well, it means fluid-filled blocked fallopian tube. Hydro is water and salpinx is tube, so water tube. Basically, the end of the fallopian tube is blocked for some reason. The impact of a hydrosalpinx is more than just not having the function of that fallopian tube. That fluid that builds up in the tube can also decrease chances of getting pregnant, increased risk of miscarriage. And so it really can be impactful, and we'll go over that in just a minute. It's hard to estimate exactly how much infertility is due to a hydrosalpinx. In general, tubal disease can be quoted as 20 to 30% of fertility issues in a couple. And of that type of tubal disease causing infertility, the estimate is it's about 10 to 20% of the time might be due to a hydrosalpinx. Topic number 2, how do you diagnose a hydrosalpinx? Well, you need to see it, and you can see it visually with ultrasound or a test like a hysterosalpingogram or saline infusion sonogram, or you can see it on a laparoscopy, a little camera in the belly button to look inside the pelvis and abdomen, and you can see that dilated, swollen, fluid-filled tube that is blocked and not able to spill. I would say it's most often diagnosed with a hysterosalpingogram or HSG. Hysterosalpingogram is a very typical, one of the first steps done in a fertility evaluation. Fertility evaluation, you want to make sure you got the basics, that you've got eggs, they're ovulating, that you've got sperm exposure, and you're checking on anatomy. And the way to make sure that the tubes are open is a hysterosalpingogram in which fluid is placed through a tube into the uterine cavity, and then under fluoroscopy, the fluid is watched spilling through the fallopian tubes. I tell my patients that fallopian tubes are like pipes. Even if you could see them, you don't know if you're open unless you can watch fluid go through those tubes. I've got some excellent education here on YouTube going over what to expect for a hysterosalpingogram and some images that can kind of help you see what's normal or what's not normal. Hydrosalpinx on a hysterosalpingogram has a very specific look. That fallopian tube is blocked towards the distal end of the tube that is kind of closest to the ovaries and should pick up the egg after ovulation. And it is swollen and looks like a sausage, honestly, compared to a little kind of thin fallopian tube that sort of spills out through the rest of the abdomen. Now, you can get a hint of a possibility of a hydrosalpinx on ultrasound because sometimes you'll be looking at the uterus, you'll be looking at the ovary, and somewhere kind of in between those two structures, I can sometimes see on ultrasound some fluid-filled structures that I think, I wonder if that is a hydrosalpinx. Now, you can be tricked on ultrasound alone diagnosing a hydrosalpinx because the intestines are in there. Sometimes cysts on the ovaries can look like a hydrosalpinx, but you can get a suggestion of a possibility that it might be there. Laparoscopy is also a very easy, kind of clear way to diagnose and even treat a hydrosalpinx. The fallopian tube looks enlarged, swollen, and if you're trying to flush the fallopian tube, it'll be blocked and it will not be able to go out the distal end of the fallopian tube. Topic number 3, what causes a hydrosalpinx? Well, it's damage and scarring in the end of the fallopian tube. So it's unable to drain, it fills up with fluid, and it gets swollen. And so what causes that scarring? It could be a history of a pelvic infection, pelvic inflammatory disease. Sometimes people can have silent infections and not realize that they had them. It could have happened years ago, and just the fallopian tube got damaged, and as it was trying to heal itself, it blocked off, caused blockage, and that tube has just been slowly filling up with secretions and fluids and gotten swollen and swollen and swollen over time. Another cause could be a history of endometriosis. Endometriosis is a chronic inflammatory condition impacting about 1 in 10 reproductive age women that is often associated with painful periods or pain with intercourse, and sometimes, but not always, associated with difficulty conceiving. Endometriosis can be affecting the function of the fallopian tubes, can sometimes cause scarring if there's adhesions from endometriosis in the pelvis and the tube kind of gets caught up in those adhesions and it gets walled off. And then again, that tube gets swollen and filled up with fluid over time. Another cause can be a history of pelvic surgery. So it could be a ruptured appendix. You had surgery, it was inflamed at that time, and the way the tube healed, you get that obstruction, scarring, and results in a hydrosalpinx. Could be a history of an ectopic pregnancy, in which the pregnancy implanted in the fallopian tube and you had surgery, or maybe you had medical treatment for the ectopic pregnancy, but the way that the tube responded and healed after the ectopic pregnancy, it was blocked and it results in a hydrosalpinx. So any sort of pelvic surgery, especially if it's around the ovaries or the tubes or the uterus, sometimes can result in scarring in that tube and result in a hydrosalpinx. I do not want you to worry that if you've had surgery that you are automatically going to be diagnosed with a hydrosalpinx. It's not typical for the body to heal that way, but when someone has a diagnosis of hydrosalpinx and we're trying to think what could have caused this, very often we're thinking about infection, endometriosis, or a history of surgery. Topic number 4, how does a hydrosalpinx impact fertility? I can think of 3 main ways. Number 1, blockage of the tube. So a hydrosalpinx, the tube is blocked, it's swollen, it's no longer functioning. Now, if you have a normal other fallopian tube, you can still absolutely get pregnant and have a successful fertility journey, even if you have a hydrosalpinx, because at least that other fallopian tube is normal and working. But if the fallopian tube is blocked, then it's going to be a little bit of a lower chance of conceiving with a hydrosalpinx in place. The second way it can impact fertility is if that hydrosalpinx isn't completely blocked, or the embryo is able to somehow make its way up from the other side of the fallopian tube into that side with a hydrosalpinx, you can have a higher risk of an ectopic pregnancy in the future. And that is not a pregnancy that is viable. It has implanted in the fallopian tube. It's not going to continue. And that's considered a cause of infertility. And the third way that a hydrosalpinx can cause fertility issues is even if an embryo is able to implant in the uterus, if the hydrosalpinx is there, there's a decreased chance of implantation and normal development of that embryo. And there's multiple theories about this. There's an excellent review article from 2021 that I will include the link in the description below, where these authors gathered a lot of information over the decades on hydrosalpinx, both chances of fertility issues, causes of fertility issues, and also looking at laboratory studies, looking at that fluid that builds up in the fallopian tube and how it can be toxic to embryos. So even if the embryo implants, having a hydrosalpinx in place can decrease the chances of a successful pregnancy because of toxicity to that embryo, or just the fluid flushing the embryo out of the uterine cavity, just really disrupting that delicate implantation process. I learned something new from this review article I want to share with you. This is one of the reasons I love continuously learning, because I finished my medical training 20 years ago. We're always learning things. So there's a really important gene, HOXA10, that needs to be expressed within the uterine lining to allow for embryo implantation. And scientists were able to show that when a hydrosalpinx is in place, expression of that gene is extremely disrupted. And after the hydrosalpinx is removed, typically with a salpingectomy or a surgical removal of that tube, that gene expression is normalized again within the uterine cavity. So it's not only a mechanical blockage or an increased risk of ectopic pregnancy, but truly just the presence of a hydrosalpinx can disrupt embryo implantation on multiple different levels. Physically, that fluid flushing the embryo out, toxins to the embryo that are found in that fluid, and then this disrupted gene expression, which is so important for embryo implantation. So topic number 5, treatment of hydrosalpinx. You've got the diagnosis. You have tried to figure out why it happened. You're really thinking about your fertility, and you're going to have a discussion with your doctor about what to do. Listen, if we could fix a hydrosalpinx, we would. But honestly, that tube is so stretched and disrupted by just the process of becoming a hydrosalpinx, it is beyond repair. Decades ago, surgeons tried to repair hydrosalpinx, basically do an incision and try to oversew the fallopian tube. And of course, there's sometimes where people were able to conceive in the future, but truly trying to do tubal surgery, those tubes are so delicate that repair often would just result in more scarring, blocked fallopian tubes, and even an increased risk of ectopic pregnancy. So the desire to want to fix that tube or keep that tube is really normal. I validate that feeling. But if it truly is a hydrosalpinx, it's beyond repair. And most of the time, your doctor is going to recommend removal. And removal is a surgery called a salpingectomy. It can typically be done laparoscopically. So that means a little incision in the belly button to place the camera, a couple more smaller incisions lower down to have instruments pass into the abdomen and pelvis to allow the removal of that tube out of the body. And it is incredible how well the body can heal. If you have a salpingectomy, sometimes people have worried, like, gosh, is that going to disrupt anything with the rest of my fertility? If I remove a structure, am I decreasing blood supply to the ovaries? Am I impacting my egg count in any way? And that review study from 2021 that I mentioned earlier, and I'll share this again, they actually looked at studies that were following up ovarian reserve after salpingectomy. There's wonderful blood supply to the uterus and to the ovaries after salpingectomy, and there was no decrease in antral follicle count in patients before and after salpingectomy. So I hope that that is reassuring for you. Now, there are rare cases where people have such significant scarring in their pelvis and abdomen that pelvic surgeons are unable to safely remove the entire fallopian tube. And so sometimes the surgeon will actually tie off the fallopian tube at the juncture between the uterine cavity and the tube so that they can't safely remove the tube. There's so much scarring, but they can disrupt that communication from the hydrosalpinx and all that toxic fluid into the uterine cavity. And so it's not a salpingectomy, it's basically blocking that fallopian tube from having any backflow into the uterine cavity. Now, after the surgery or after the blockage of that fallopian tube, the risks and impact of Hydrosalpinx is removed. Next steps are really discussion with your doctor. So sometimes people will go on and conceive naturally because their other fallopian tube is totally normal and they're still ovulating and they've got great sperm exposure. Sometimes people will do fertility treatment, whether it's IUI or IVF. But I don't think that just having a Hydrosalpinx and having it removed means that someone automatically needs to do IVF for their next step in their family building. It is an option. And of course, you need to talk to your doctor about the right next steps for you. So let's recap. We learned a lot today. We learned exactly what a Hydrosalpinx is. We learned how to diagnose it with imaging, or maybe it could be seen on a surgery like a laparoscopy. We talked about causes of Hydrosalpinx, typically infection, endometriosis, or a history of surgery. We reviewed how it can impact fertility, not only damage and inability of that tube that is a Hydrosalpinx to allow fertilization to happen, to a mechanical disruption of fertility, but also that fluid can be toxic to implantation, affecting the health of the embryo, affecting gene expression within the uterine cavity, and really disrupting the whole very delicate implantation process. And finally, we went over treatment options for a Hydrosalpinx. I included some of them, but you can talk about all the options available with your doctor and find out exactly what's right for you. I hope you found this video valuable. Like this video if you learned something, comment with questions that you have, and be sure and subscribe to this channel so you get my weekly videos all about reproductive health. Don't forget about the podcast out every week and the newsletter. And until next week, I'm wishing you love, luck, and pineapples.